Mike Nagorski. I currently serve as Director of Research for the Saskatoon Colostrum Company. Today, we're going to be discussing beef calf protocols for the beef cow-calf producer. And so a lot of people ask, well, why do we need to use colostrum supplements and replacers in our beef cow-calf operations? And the reason being that the biggest one is that there's approximately 30% of our calves on the beef cow-calf operation, as per our NOMS studies, that show that are actually failing passive transfer. So there's 30% of calves that are failing passive transfer. And as we know, the importance of failure of passive transfer is particularly important just in terms of feed efficiency. Calves that fail passive transfer will have upwards of a 50% fallout in feed efficiency during their lifetime. And that's probably the biggest of most economic importance as we think about these calves being born. And so are we thinking that we're going to use colostrum supplements and replacers for every single calf? Is that what we're recommending? No, absolutely not. But there does exist a lot of opportunity, given the rate of failure of passive transfer on our beef cow-calf operations, to utilize adequate tools such as a colostrum supplement or replacer to mitigate the risk of failure of passive transfer. And so we're going to go through this beef cow-calf protocol. And this protocol is designed to help us identify those risks and what to do during those first 12 hours of a calf's life. And so that's what we're going to discuss. So as we know, there's some parameters that really define and set the foundation for this entire protocol. And so I want to bring light to that. So as you look at this protocol, you'll see a lot of different colors and it can kind of be overwhelming at first. But what we got to keep in mind is our checkpoints. So I'll bring your attention to the left side of the screen here. It all starts and ends with timing. So if you look down this left-hand side here, we have checkpoints, and that's the time part. We know that calves absorb the most antibodies and bioactive factors in colostrum, both our colostrum replacers and supplements, as well as with mom when they get up within the first 2 hours of life. So that sets the first checkpoint, okay? The second checkpoint is at 6 to 12 hours here, as seen below, okay? After 12 hours, we don't get that time back, and they are going to absorb very minimal amounts of antibodies in colostrum, okay? So that sets the standard here for our protocol as we see it up on this screen. The next thing that we have to consider is calving ease, okay? So you'll see at the top here, we've got calving scores. So calving scores are identified on a scale of 1 to 5. And so you got 1, 2, 3, 4, 5 here. And 1s and 2s are basically no assistance or some assistance. And then a 3, 4, or 5 is your C-sections, anything that's a major, or if you're going to use a calf jack at all, or an abnormal presentation, okay? So calving score is another thing that we have to consider. And so we've got timing and we've got calving score, and that's going to define, when we think about beef cow-calf, a majority of what we're going to do with these calves as we think about whether or not we're going to use a colostrum supplement or replacer, okay? So as I said, the point of this is not to necessarily utilize colostrum on every single animal, okay? We do know that first calf heifers tend to have the problem with not producing enough colostrum, okay? So there is one application where we do see the use of colostrum supplements and replacers utilized on almost every first calf heifer. That does exist, okay? But realistically, what we're really after is the goal here, okay? So we've got our time on the left-hand side, calving score, and the goal here, okay? So the goal is going to be based on the time, okay? So ideally, what happens, okay, so let's talk about normal calving, where we're not going to use any colostrum supplements or replacers. And this is going to happen on approximately 70 to 90% of our calvings that we see done, okay? So the goal is that a cow has a normal calving, okay, no assistance. Maybe she had some and it was an easy pull, okay. She's got a full udder and she's got adequate teat conformation. So everything is ideal. And the goal being that when that calf is born, as we consider this calving score 1 or a 2, that within the first 2 hours, the calf is born, it stands up, okay, the dam and the calf have bonded, okay, and that's a very important process. So that dam is going to identify her calf by licking on it, and she's going to put her scent onto that calf through her saliva, and that's how she's going to identify. So that licking process is the process of them bonding. Obviously, if she gets protective and she tries to protect her calf or even try to kill you, you know they've bonded, right? But it's a big process. So if we pull a calf away from mom and we intervene, we don't want to mess up that process. So the goal is, again, no assistance, okay, good calving score, full udder, adequate teat conformation. The dam and the calf have bonded, so she's licking it off. The calf stands up and is nursing vigorously. There's no need to intervene in those type of scenarios. If that happens, I would say the majority of calves are going to be good to go, and we don't have to intervene after this. If they get up and they nurse that dam within the first couple hours of life there, we're pretty much set. Very rarely would we ever have to intervene again at that 6 to 12 hour period, unless something happens to the dam, okay, where for some reason she would die within that time. But again, very rarely are we going to have to do anything. So the goal is, and this is going to happen on a majority of our calvings, okay, that the cow is going to have no assistance. She's going to have good udder and teat conformation. The calf's going to get up. They're going to bond and going to nurse within the time checkpoints here. That's where we're not going to intervene. We don't need to intervene there. In fact, actually intervening in that type of a scenario would probably be detrimental to that calf's ability to absorb antibodies adequately and all that. So we don't need to do that. So that's the goal, okay? Let's talk about, though, where you do have somewhat of a normal calving, maybe some assistance, okay? And the cow's really, for the most part, good. When would you use a colostrum supplement or replacer? Well, again, if we look in the first couple hours of life, okay, and that calf, for example, let's say that it just, in that first couple hours of life here, where we're at here, the calf gets up, it's standing, but it's just kind of trying to nurse the mom, but it's really not successful. That would be somewhat where we would go in with a supplement, okay? And a supplement we define as something that contains about 50 to 60 grams of IgG, okay? What a supplement is going to do in that sense is just give the calf energy, okay? At 50 to 60 grams of IgG within that package, it's not going to be enough immunity for that calf to have a really significant degree of immunity to do anything, to be honest, okay? So by providing 50 to 60 grams of IgG, yes, it is IgG, but more or less it's more just an energy supplement. And by the way, that needs to be bottle fed. So that's what's indicated here. Okay, so typically a supplement will be utilized just to kind of get them up, get them going, give them some energy, and get them back on mom so they're nursing them, okay? Where we're going to get into a replacement dose, and a replacement dose could be anywhere from 115 grams of IgG to up to 150 grams of IgG, okay? We say a replacement, but we know that if, let's say, a calf is born and it's not going to get any colostrum from mom, they're going to need upwards of 300, right? But where we can utilize a colostrum supplement or a replacer is within this first few hours of life. As they failure get up and stand, there's no suckle reflex, there's muddy conditions, or there's twins. Typically one twin fails passive transfer and one succeeds. And so we definitely want to be wary. And if we do know that the cow had twins, we know which one was born second. Typically the second one is the one you want to provide a replacement dose to. So where we see in the cow-calf enterprise, the use of a replacement dose is typically this 115 to 150, okay, where it's tube fed within those first 2 hours of life. What that does is it provides just a basic, it's going to provide a base amount of colostrum immunity to that calf, okay, with the intention that if we tube feed 115 to 150 grams of IgG within those first few hours, the goal being, going back here, that it's going to get up and suckle mom, and then it's going to top off that calf in terms of fully replacing that calf. So again, you can do this a couple different ways. There are supplements between 50 to 60 grams of IgG. You could provide 2 of those to give that 115 to 150 grams of IgG. So you could use 2 bags of a supplement here to get up to that total dose, okay? Or we just do the 1 bag if that's what we have, depending on the product that you're using. So again, that's a really nice application within the first few hours, tube fed at that type of a dose, where it's going to give, again, that baseline amount of immunity. And then that calf, the expectation is that calf's going to get up within 12 hours here, okay, and be nursing its dam, okay? About, if we do something like this with this replacement dose at 115 to 150 here, 90% of them should be up with by that 6 to 12 hour period already nursing, okay? And we won't have to intervene down here, okay? So that kind of sets the general, scenarios of what we're going to do here within this first couple hours when we utilize a supplement or replacer, okay? And again, most people now are getting comfortable tube feeding and at this 0 to 2 hour period or so, and tube feeding that 115 to 150 grams of IgG, depending on the product you're doing, okay? So that'll take care of that one. Then we have major calving difficulty here with a C-section, or maybe it's abnormal presentation like a backwards calf, right? Could also include dam death, poor udder development, poor teat conformation, inadequate bonding, okay? All those scenarios here are encompassed up here. And then, of course, we've got time going down here. We do know that calves that are born via dystocia, so they're pulled, they have a difficult pull, puts stress on that calf, and for whatever reason, it will actually decrease their ability to absorb IgG in colostrum. Therefore, these are the type of calves where we do typically have to use a colostrum replacer, and we want to get really aggressive with them because they won't absorb enough. And so what you have to do is typically, as well, is that these calves lack a suckle reflex, and that's due to prolonged calving or even stress. They go through what we call a respiratory acidosis or alkalosis, and that causes this issue with them, their ability to suck. Therefore, if you've got a major calving difficulty, one of the best applications for the use of a colostrum replacer is actually in that scenario. And what you would want to do is feed a high dose of IgG. So we're talking about typically 200 grams of IgG tube fed to those calves. Could you do 300 if it's a big calf? Yes. Typically, these calves are big calves, and that's why we're pulling them, right? So ideally, what the scenario we do in the first 2 hours of life is at least tube feed 200 grams of IgG. There is a product for that. Again, you can use different types of products as you can put them together to equate to that 200 as well. So feed around between 200 and 300 grams as soon as possible after birth. And even then, they're going to have somewhat of a decreased ability to absorb those, but that's why we want to get clean colostrum that's standardized into them right away. And then again, whatever we need to do in checkpoint 2, so that's 6 to 12 hours here. So let's say that you feed 200 grams here, you're going to want to follow up with at least another 100 grams here. So again, you want to calculate the additional mass needed to meet the desired immune level. So a high replacement dose is 200 to 300 grams of total IgG within that 12-hour period. So again, let's say you feed 200 here, okay? You're probably going to want to feed another 100 here to get them up to 300 grams of IgG. Same type of scenario, like let's say there's a dam death, there's really poor udder development, you just don't think there's enough there, like a first calf heifer. There's really, really poor teat conformation or not, you know, let's say a cow, they don't want to bond with it. You know, again, you're going to want to get that 200 to 300 grams of IgG into them here within that first 12 hours, with the highest importance being in that first 2 hours here. So that's where this red side of the graph works, and how you want to utilize it. Okay. Very rarely, again, if you get done supplementing, or if you've done an adequate replacement dose and you don't get on to mom by checkpoint 2, that's again where you're going to provide that second feeding. And like I said, if you're up in this scenario here where you do provide a replacement dose here at that 115 to 150, okay, with the intention that the calf does get up and suck mom, but it doesn't, that's again where you're going to want to come here and provide that dose to get it up to that 200 to 300 at least. Okay. You might say, well, what should I do? Feed 200 or 300? Well, if it's a heifer calf and you're likely going to be retaining that heifer in your herd, remember what we do here in the first 12 hours of life via colostrum is going to set the tone for how productive they are. We are going to have implications here with milking ability all the way clear out in the first 2 lactations with these calves by what we do here. And so if you do 200 and, you know, that's fine. That'll get you by, but 300 is really now the gold standard for what we need to provide in terms of adequate IgG to these calves. So I hope that this helps kind of walk through this beef protocol, and certainly reach out to any of our staff here at SCCL if you have any other questions. Thank you.